Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss what is the best time to plan your pregnancy in the month. Let's get started. So in this video, we are going to discuss what is the best time for you to have the intercourse so that it increases the chances of having the pregnancy according to your menstrual cycle. If you are someone who is having a regular cycle of 28 days, 30 days or 31 days, the most fertile period is going to be between 12 to 16 days. Ideally around 14 days, but say it in a range, it's going to be from 12 to 15 or 16th day. So here I say 12th day, 16th day based on the day of your menstruation. We consider the first day of your menstruation as the first day of your cycle. So you will be having your periods from 1 to 5 days or 7 days depending on your flow. So after the bleeding is finished, there is going to be another ovulation cycle which is just starting out. So the day the ovum is released from your ovary, it is called the ovulation day, and the chances of pregnancy is high when intercourse happens when the ovulation occurs. Let us say it's 14th day, which is the ovulation day. So we are not sure exactly if the ovum is released that day. That's the reason we take it as a range between 12 to 16 days. During this time, your gynec might advise you to have intercourse once in the alternate days to increase the chances of pregnancy. What if your periods is irregular? You're not having a regular cycle, say you're having periods in 60 days or 90 days or 45 days, which is not actually clear to you. So your gynec might advise you to undergo follicular study, which is a set of ultrasound scans, track the growth of the follicles as well as the rupture of the follicles on your ovulation day. So this would give us a fair idea on when the ovulation is happening, and that way if you are going to have intercourse on the alternative days around your ovulation day, that's going to increase the chances of pregnancy. Before I end this video, let me make this one thing straight. Pregnancy might not be successful on the very first attempt. Your cycles might be right, your ovulation day might be right, you might be doing everything just right, but not necessarily every woman would get pregnant on the first attempt. So try to be patient and do not be hard on yourself. Be consistent. If you're having irregular periods, do reach out to your gynecologist for a follicular study and to get the other tests done to see what is the reason for having irregular periods. I hope you found this video useful. If you like to see many such informative videos, then do subscribe to my channel and press on that notification bell icon so that you don't miss out on any upcoming videos in my channel. Do drop your suggestions in the comment section to help me serve you better on most important topics in the upcoming days. Until I meet you in the next video, stay happy, stay mommified.